For all the national discussions about health care and reform, one thing is clear, and that is that nothing is clear. We surveyed some folks at Philadelphia's Reading Market this week about the confusing morass that is the American healthcare system.
Probably in this day and age, just knowing which doctor is in which network.
Paying for it, really.
How to compare the different providers,
what's covered, what's not.
Paperwork. I don't know, all the papers involved.
The options, there's so many of them.
Dealing with issues like pre-existing conditions.
Understanding your benefits. I worked for an insurance company. Most of the time when we would receive calls, it was to explain benefits and to explain why benefits were denied.
Makes you wish you had someone to hold your hand through the entire process, doesn't it? Well, that's why the job of healthcare advocate was invented. Here's a look at one.
My name is Betty Long, and I'm president and founder of Guardian Nurses Healthcare Advocates. The analogy that I always use is that you wouldn't enter the legal system without an attorney. And I think that it's likely that you shouldn't enter the healthcare system without an advocate. Who better to advocate for someone than a nurse? I think the healthcare system is complex. Patients who are confused don't really know which way to go, and I think it's helpful to have someone by your side who understands the system, who understands what needs to happen, what needs to be asked, and we can take that stress from them. It's not that we tell patients what to do, it's we guide them and give them the options so that they can make a better decision. Is it better or worse for your loved one to endure this chemo, this experimental treatment, or is it better to have a quality of life that allows him to interact with his family? Guardian Nurses was really started in 2003. My uncle had fallen and had a cerebral bleed. He was taken to a critical care unit, and my aunt called me, and I went down, and there was a moment when the resident was talking to my aunt and telling her that we're going to put a breathing tube in your husband's throat. And I saw my aunt nodding her head, and I looked at her and I looked at the doctor and I thought, she has no clue what he's talking about. What do other people do that don't have someone like a nurse or someone clinical to explain it after the doctor leaves? A lot of us who are young and healthy don't think about that. And maybe if we've had an experience where one of our loved ones or our parents have had that, then maybe it's more in our head and we'll consider it. But most people don't think about it.